All right, so this is a great example of the incision, and you can see on the left side, the incision is still closed because that was the side that was suspicious, so I only opened up one side, so we don't have open wounds on both breasts, and what's coming out is a goo. These are the older implants that are no longer shape stable. In that period of time when that implant was put in was probably about 15 years ago. That was a different type of gel, and you see how it came out. I'm trying to wipe it off my gloves. It's just a sticky, gooey mess. So once we find that, now we kind of reorganize the whole case. We have to deal with what I found, pull out as much as cleanly as I can, and the rest is we lay soaked towels all around the area to basically contain any further gel that's still in there. And in those cases, we have to do not just an evacuation of the gel. And we got to make sure all the gel's out, so we got to remove that capsule that is covered in gel, because we don't want to leave any gel behind. So we have to do an en-bloc capsulectomy. So we're going to be here at least on this side for about an hour, in addition to the case. We also have to remove the scar tissue around the implant, which is embedded with that, and that is called a capsulectomy. That was not part of this procedure. This was going to be a removal of implants for new implants and a replacement, which is the removal and replacement case, and go a little bigger. And instead, it turned out to be a removal of a ruptured implant and then capsulectomy. Once that was completely done and perfectly done, I need to say, because you need to get all the gel out. You don't leave any behind, not because it's going to make them poisoned, but it's not a vitamin. That gel, when it's free, can go into lymph nodes, can go into adjacent tissue. It's not good. You want to not have that migration of that free gel. So with that, we got to remove it all, take out the capsule, which is called a capsulectomy, which is all it is collagen or scar tissue that forms around the implant, because the implant is seen as foreign when they're put in. It takes about 3 to 6 months to form, and that is around every breast implant, that scar tissue called a collagen of tissue, otherwise known as a capsule. And remove that capsule, thus the word capsulectomy, removal, and then once that's clear, once we irrigate it, once we inspect it, once that's completely removed along with the capsule, that area has been evacuated of any free silicone, then we can really start the case we intended to start. So that it becomes very complicated, but the point is you got to know how to deal with it and deal with it perfectly, not just good, but perfectly, which means leave no gel, or as humanly possible. Put in that white gauze lap sponge, and I go into the pocket through that small incision, and I bring it out, and there's no gel on it, there's no blood, there's nothing. It's just a pristine environment. That's when we can now open up the incision on the left side, which I did subsequently, found an implant that was perfectly intact, and you'll see how that looks, which it comes out as an implant, as opposed to a gooey mess. And then we can complete the case with some caveats, because what I did on the right side is far more drastic than I'm going to do on the left side, meaning the capsulectomy, all that. So then we got to, try to be as precise as we can with symmetry. Final result, she's pretty even. The only difference is on one side, the right side, she's going to have a drain, which I don't need to place on the left side because, again, that implant was intact. So these cases are tricky. These cases require a team around me that can deal with it. They know the next step. It's like a dance. All of a sudden, the music changed, and we can go to the samba instead of the waltz. And that's why it's important for the surgeon to have his own ORs, his own surgery center, his own team that's worked with him for years, and predictability, because predictability allows me to bob and weave in the OR, which often needs to be done. The point is to finish the case successfully, and not always as predictable a case as one would expect. And that's the nature of surgery. Thanks a lot again. Dr. Sergio Maggi here in beautiful Austin, Texas, at my place, the Austin Plastic Surgery Center. Cheers.